National Institute of Homeopathy, respected Professor Ganguly, respected faculty members and dear students. So we have been listening from Professor Ganguly, Professor Heena, sir. So I will be sharing some of my views regarding this topic, which I think is quite relevant to this modern system of modern medical practice, be it homeopathy, be it something else. The topic is titled as Communication Skills for Medical Professionals. Now, talking about communication skills, this is a very relevant topic. I don't know about our country, but in abroad, this has taken a very important place even for medical faculties. That means medical faculties are being trained to develop this skill. And the reason for that, I'll be sharing with some of my experiences also and some of my views on that. So, first of all, if you just communicate, I think there's an overlapping of this picture. If you just communicate, you can easily connect with the person. But if you communicate skillfully, we can do wonders. Why do we say that? Because in homeopathy, in medical practice, we need to be skillful. The reasons are several. Just now, in previous lectures, we were hearing from Professor Heena sir regarding ignitia. He was mentioning that ignitia speaks softly. So, to hear from a patient, to observe a patient, everything is communication. And we need to develop this skill. This is not to be developed in a single day. This is not to be, you can say, learned in a single day. It's a continuous process. And so, I'll be sharing some of these views, which I think will be relevant for you, for all of us. So, what is the need for this topic? So, these medical services we know are highly complex. They are highly complex and they're very technical. Be it homeopathy, be it any system of medicine. And whenever in any healthcare environment, the patients are being challenged emotionally because they have to go through. If you just take our case taking for example, in your OPD also, most of you have also observed that most of us, when we take the case, it is not always that the patients cooperate with us very friendly. Often they are bored, often they get angry also sometimes. So why you are asking so many questions? So it's a very grueling process. Not only grueling process regarding case taking, it may be with some diagnostic procedures also, maybe grueling for some physical examinations also. So overall, it's a very grueling process and we need to be skillful so that we can communicate our objective, we can get what we want from the patient and we can prescribe accordingly. Because our ultimate term is to prescribe skillfully and prescribe the correct medicine similarly. Now, for that the patient has to have a trust on the physician. That is most important. You have all learned along with your undergraduate courses, the books of organon, books of philosophy, etc. And we all know that in everywhere it has been time again reiterated that a physician needs to develop the confidence of the patient. Say for example, when we talk about taking mental symptoms, in some of the philosophies you find that suppose we take Elizabeth Wright, philosophy book of Elizabeth Wright, it's being mentioned that this mental symptoms should be taken at the end of a conversation or when you have developed the confidence. If you take, for example, Kent's lectures, Dr. Kent has mentioned there is no particular time for taking a mental symptom. Whenever you feel you have achieved the confidence of the patient, if the patient is confident enough or he has trusted you to relate, because mental symptoms, sexual symptoms which are very, you can say, personal things, they are very not easily being narrated to us. That's our skill we need to know. And this communication skill, because at the end of this presentation, I think we can just relate. My aim is actually, there is nothing new to this communication skill. Most of you all know. It's a very day-to-day practice. And most of it we find in our organon medicine also. I will not be teaching organon here because we have legends of organon and organon medicine. I just give you some points. At the end of this presentation, at least we can relate what is communication skill, how communication skill is important for medical practice in this modern era, and what we are trying to establish today through communication skill has been told by our master Hahnemann long before. That is being coming in a new form. We'll just see to that. Now, the process of delivering care includes interactions that occur between the patient and the healthcare system, and it includes two things mainly. One is clinical care and one is the interpersonal care. What is clinical care? Clinical care includes the diagnostic part and the treating of illness. We all know diagnosis is equally important. We cannot say that being a homeopath, we will not diagnose a case. Diagnosis is equally important, or else Master Hahnemann wouldn't have mentioned knowledge of disease in aphorism 3. So everything is important to us. For a treatment, for a management of a case, so diagnostic and the treatment of the disease, that comes under the clinical care. But equally important is another aspect, that is the interpersonal care. The terms may be new, terms may seem new to homeopathy, but it is not new. The same thing was being told by Master Hahnemann long ago. So what does interpersonal care mean? It means the interaction with the patient, with the physician or other healthcare provider, which requires skills such as communication, building trustful relationship, honesty, respect, empathy. You know what is empathy? To understand, if the patient realizes, yes, the doctor is understanding my feeling, the symptoms will come out more easily. If he understands, no, the doctor is becoming more professional, he's just taking me as you can say income, source of income, then he or she will not relate to you so that's very important. And I say this very easily, but I think everybody knows it's not a very easy thing. It's time to develop this. And compassion. So we have all seen in our younger days also, I myself have seen, we have all been to physicians. And we as a child especially, or as a student or as a child, we have seen physicians who will examine you, who will, you can say, take what is necessary for him, from you, but without knowing you, without letting you know that. Suppose a child comes to you at your clinic. It's very difficult to examine a child. It's very difficult to ask questions to a child. So the physician has to be skillful. While playing with him, while talking, suppose you just take any other example. A patient suffering from an anxiety disorder, or suppose any cardiac ailment, and you go to the patient and you just before examining him or her, you say, look, I think you are having anxiety. I am going to examine your pulse right now. If your pulse is more than 100, it's very bad for you. But it will be more than 100. So you need not, while talking to him or her with some other things, to examine the pulse. So that is the skill we need to develop. In this recently introduced curriculum for BHMS course, we all know the competency-based dynamic curriculum for BHMS course by the National Commission for Homeopathy. They have mentioned this part, very important. We need to draw up generic competencies under 4 relevant areas of the functioning of physician. Cognitive, understanding power, the physician himself should be, you can say, realizing what he or she is doing. Personal development of the physician is equally important. We as physicians, we as teachers need to develop ourselves. If we don't develop ourselves, how can we treat patients? Interpersonal and in the community. We all know we have a role to play with the patient also. We have a role to play in the community also. Aphorism 4. And in the interpersonal competency, this part, communication skills plays a very important role. So it has been introduced in the BHMS curriculum also right now that we need to develop this. So I think with time we will be teaching this communication skill also in our BHMS course. I don't say that this was not there in our BHMS course, but it has been further emphasized because with this modern day system, the modern disease scenario, everything is changing. So that's why this is equally important. And this effective communication skill have to be learned and improved. It is not a one-day process. Now, what is communication? These are some of the very dictionary meanings which we all know. Communication is the sharing of information between 2 or more individuals or within the group to reach a common understanding. These are not talking about only medical interactions. It's communication in general. Because this communication skills in nowadays are taught in the management courses also, in corporate offices also. It's very important. Day in, day out, you will need this for in purpose, business purposes also. The word communication comes from the Latin word communicare, means to share. And this communication is actually a two-way process, we all know. We cannot communicate without the other person being totally off. The other person has to be equally involved. So it's a communicate, receive, feedback, it's a continuous process. And effective communication is a process of exchanging ideas, thoughts, opinions, knowledge, and data, so that the message is received and understood with clarity and purpose. Now, how does that relate to homeopathy? We'll come to that. Now, while the effectiveness of communication can be difficult to measure, its impact is hard to deny. That means, it may be very difficult for us to communicate very easily with persons or patients, but once you communicate, its effect is very long-lasting. Long-lasting for your selection of medicine, long-lasting for your satisfaction also as a physician, and long-lasting for the patient's good health also, because he or she will be cured in good time, if it is a curable disease, of course. Now, these are some of the general, I have taken some of this from the learning teaching methods of communication also, which have been taught worldwide right now. 7 C's of effective communication. And how does that relate to us? Correct, complete, concrete, concise, courteous, clear. These all terms are general terms, but they equally relate to us as physicians when we treat the patients. How come that? Because we need to be clear of what we want from the patient. If I myself am in doubt that what I want from the patient, so I cannot communicate, or I cannot get what I want. So these terms, I am not going into the details of these terms, but these terms are equally important. Courteous, we all know. We cannot be very rude to the patient. No patient will, nobody will react to us or respond to us if we are rude to him or her. We need to be courteous. And this courteousness, these are all we need to inculcate within ourselves. I have seen in my brief teaching career students who are very naughty in the class, very disturbing in the class. They have turned out to be the best of the physicians. I don't say that everybody learn naughty, but it's a skill. So it is nothing which we learn from the book, it is with time what we see. Why do I say that? The person I have seen to be developed as a good physician, he was naughty, but okay, fine, he is disturbing in the class, good at studies also. The way he interacts with persons, and another student I have seen who was suppose the topper of the class, very introvert, never participated in any games, never participated in any social activities, always into the books. I don't say that he or she is a bad student, equally good student. But when you come to this practical life, just as Dr. Ganguly was saying, there's a huge difference between the bookish knowledge and the practical knowledge. When it comes to the practical field, be it anybody, myself or any speaker, when we come here, it's very easy to say, but in practice it's totally different. It's your entire, you and the patient, your entire domain, your own skill. No book can teach us how we will extract the symptoms from the patient. I can crack a joke if I want to with the patient, if I feel that cracking a joke will give me the result, or I can be serious also if I see that the patient is not taking me seriously, so I can be serious also. That is upon my measure. I have to judge that. Nobody can teach us that. Okay. So these are the 7 C's, and effective communication in healthcare, we should be clear, timely, and brisk. Once again, the same thing. The communication is needed to make accurate diagnosis of disease. If you take the book of philosophy, Dr. Elizabeth Wright and others, often we find this, that they say that when the patient, everybody says that when the patient enters, your duty starts from there only. You start observing the patient. Observation doesn't only mean that how he or she is behaving, or I want to judge the personality or mental picture. Observation may also indicate some clinical condition. The way he or she is walking may indicate, the gait may indicate some disorders, some nervous system, etc. So this communication is to make accurate diagnosis of each individual case of disease. What we do in homeopathy, we treat each individual case as an individual case, ensure that treatments are properly provided, and to ensure that patients understand the health status and their needs. So communication is all over. How is it? You will come across in the subsequent slides. Commonly know this. What are the types of communication? Based on communication channels, they may be verbal, maybe oral, or maybe written. We can always ask and we can get the answer, or we can provide a written kissing performance, we can take. I'm talking about the physician and this doctor perspective, patient perspective, and even non-verbal. If you make a statistical analysis, we see communications are maximum non-verbal. Verbal is very less. And if you base on the style and purpose, it's formal and informal. With friends, we are informal. In a very corporate gathering, official gathering, we are formal. But this formal, informal, it's a very flexible. There's a very thin line of difference of formal and informal when you are dealing with a patient. You cannot be too formal, or you cannot neither can be too informal. So that you have to judge accordingly. But these are the general types of communication we have. Now this is the non-verbal part. You see the larger domain of the non-verbal. Verbal is very easy. Verbal, we ask, we get, or we write, give some written document, we take. This non-verbal, you see, there are several parts to it. Non-verbal part. What is it? I just give the broad headings. Physical appearance. You see, face and skin, hair, physique, clothes, adornment. The patient is not saying that I'm a very clean person, or I'm a very person who maintains tidiness. I'm understanding from the way he or she is wearing his or her clothes, the amount of jewelry, suppose a patient comes with huge tattoos and all that. So the appearance of the patient gives me some, I can confirm it with some questions also, but this communication is set from the appearance only. So it's a non-verbal communication, and most of it is non-verbal. Just what our previous speakers, respected speakers, were talking about observations. So this is observation, and observation is also never a single process; it's a two-way process. So physical appearance. Then we have the haptics. Haptic means bodily contact. Most of us we get an assurance from the physician, because this is a very, you can say, I don't know, nowadays it's not there, but we used to hear in our college life also, but most of us have heard also, homeopaths don't examine the patient. Patient ke chue dekhe na, they don't touch the patient. Stool keমন color ki dekhe oshud diye deয়. But this is not so. We need to have a compassionate relation with the patient. In Elizabethan philosophy, we have this thing that a physician should know the patient spiritually, physically, emotionally. So we should have this connect with the patient. So this bodily contact is important. To assure the patient, yes, you have come to a place, curable and non-curable, that's a different thing. But at least he or she should have the assurance, because we are trying to get from the patient something which is very inner to the patient. We are not only going on the gestures or the outer features. We are trying to look into the patient. And to look into the patient, we need the patient to be cooperative with us. For that, this haptics means the bodily contact is also important. Touch the patient. Give him some compassion. Olfactics. Olfactics means the sense of smell. We know we can diagnose several things from the sense of smell. So this is also important. What do you mean by chronemics? Chronemics means the use of time. The time sense. Time sense is also important. Then kinesics means gestures, postures, bodily movement. Gestures indicate several personality. Bodily movements, the way he or she is speaking to you, the way he or she is sitting with arms crossed or something like that, they always indicate something or the other. The spatial behavior, especially regarding when the person is trying to relate something very personal, whether the patient is sitting far away from you, whether he's coming close and whispering in your ear. So these also matter a lot. You can understand some features of not only the disease but also the personality. Facial expressions. Expressions are, but we all know we can always mask our expressions. Everything can be masked, but still expressions are a very important guide for this communication purpose. You see what the things are being given. The eyebrow movement, the eyes movement, etc. All these expressions are important. Then the paralanguage. Just what Sir was saying, Professor Arun Khan, that Ignatia speaks very softly. This paralanguage means the voice and the pitch of how the person is speaking. So this knowledge in our homeopathic practice may lead us to some drugs which we have, like Ignatia, etc. Then oculesics, that is the eye movement, eyebrow movement. Whether he's having, we all know this, childs, all these things. Autistic disorders, we do not think eye contact. So eye contact, how whether the patient is contacting with you directly, direct eye contact, or whether he's just keeping his head down or something like that. These all things can, or how long he's staring at you, gaze, shying away, not making eye contact. So all these are very important features.